Hello, everyone. Good morning. Everybody, please, who's willing and able, stand with me. I'm going to introduce this topic of what I do at the hospital for the kids by actually having you do some of what we do there. So I'm just going to teach you right now. Most of you, it looks like, from the belts that you have and uniforms, that you've done some learning before, so I know you're all good at watching and listening. So I'm going to do it first. This technique is one I teach a lot called power breathing, and it goes like this. That is power breathing. You're all going to learn it now. It doesn't have much martial use, but it's very, very powerful for opening up the breath, helping to control and enhance the breath, for calming the mind and spirit. So it is very good for patients at the hospital who need those things. And it's good for all of you who are doing it now. So let's all do it together. Ready? Here's the form, and then I'm going to teach you the breath. Just the form first. You can do it right along with me. Bring the hands up the sides of the body, nice and high, and then out from the chest. Then bring them back in, gather in all of that breath, and then down the sides of the body again. Good. Very good. We've all done things like this before, I see. One more time, just the form. Very good. Excellent. Not much to speak of yet, but we're going to add the breath, and that's when it gets interesting. Ready? Breathe in gently through the nose as you come up, and out through the mouth. And relax your jaw as you breathe out through the mouth. Make a sound like, ah. Everybody do it together, like a sigh. Ah. No, really, really. Ah. Good, good. Now, we're going to do it together. Ready, go. In gently through the nose, and ah. Good. Now in again. In, out through the mouth. And one more, really enjoy it. Just let the hands fall inside. Check in for just a moment, see how you feel. It's an exciting day for many of you. So I expect some of you to feel really excited. Some of you feel very relaxed by the technique. Raise your hand if you felt relaxed doing that. Lots of people. Yeah. That's what we find at the hospital. And for kids who are going through really challenging situations, who are dealing with cancer, with sickle cell anemia, with cystic fibrosis, and all kinds of conditions that we find in the hospital, this is a really big deal for them. Sometimes it'll change the course of their treatment. It'll lower their pain. It'll stop their stress and anxiety. And it comes at a perfect time when they feel that they have very little power. They now have more power to control their own body, to control their destiny, and it's all through the secrets of the martial arts that we teach them. We do punches and kicks with them sometimes. We do sitting meditation where they just listen and are aware of their surroundings. It's very intense in a hospital, let me tell you that. But these are the main techniques that we focus on. That's why I wanted you all to be able to try them and feel what it's like to be there. So now when you see the videos, you'll have a little bit better sense of what's going on. Everyone uses a little different form in the Kids Kicking Cancer family. Well, we at UF Health Integrated Medicine, which is also related to arts and medicine, you heard that too. The history is kind of confusing. I don't want to bore you too much with it. The key is that we're there at the bedside with kids who have these serious diagnoses, helping them heal, helping them in their emotional struggle every day. And I want to tell you briefly a story about a young man who did that exact technique and who does it just about every day to help himself. At a time where he's having issues with his lungs, where they're on the verge of collapse, but he uses the breathing techniques to help himself stay calm and stay present. This is a guy who works, when he first learned the martial arts from me, he did techniques for 20 minutes, 3 times a day, breathing and meditation. Every single day, and every class that he came to, he was there and he was standing, even though he had cancer in his leg that prevented him from bearing weight. So he used the stance that many of you have learned, because he couldn't bear weight on one leg. And he would bow and participate in the breathing and then sit with much effort because he had pain in every single class that we came to together. That young man is the kind of person who does these techniques and benefits from them. So I wanted to leave you with that image. He no longer has that leg that he was able to stand on, even just a little bit, but he still practices his Tai Chi, he still practices his breathing, and he still practices his meditation in the hospital to help him now. So thank you very much for all coming and supporting this organization and all the people involved. You can ask me lots of questions if you want to know more details. There's information on the website. For now, I want you all to get excited about the rest of the demos, about the silent auction, for the adults, some really good stuff over there. And for the tournament, because I saw you'll raise your hands, about half of you are here for the first time. I want to tell you that this is my first tournament as well. I won't be competing, but I have yet to see one, and I'm very excited. So thank you all for coming, and I'm really glad to be able to see you all here participating for this great cause. Thank you.